Come in, wash my hands, introduce myself to the patient. Hi, my name is Alex. I'm your nurse for today, and I'll be doing a full physical examination on you.
Okay.
May I get your name and date of birth, please?
Sure, it's Russell to 1178.
And do you know what the date is?
I believe it's to August 7, 2017.
And your location, where are you
I'm
at?
at your clinic.
Okay, you know who the president is?
Yes.
Who?
It is Trump.
That's correct. Okay, and at the same time I'll be checking her grooming and her hygiene as well. Then I'll be taking her vital signs, and I would start with palpating the systolic blood pressure, where I'd feel for the radial pulse as I'm inflating or deflating the blood pressure cuff. Then I'll continue on and get her heart rate, her respiratory rate, her pulse ox, her blood pressure, and then I will be documenting the findings. Any pain today?
No.
No pain? Okay, then I'll go ahead and start with my head-to-toe assessment.
Okay.
So I will first start with your head and scalp. Full head of hair, thick, smooth, no lesions, no rash or abrasions. Good. Eyebrows are symmetrical, even hair growth. And then your ears are even with the outer canthus of the eye. Skin, same color as the face, warm and dry to the touch. No discharge, no excess cerumen buildup. And check the eye here. Pupils are even and round, equal and round. And I'll dim the lights and check for if they're reactive to light and accommodating. Sclera is white, membranes are pink and moist, and I'll check for extraocular movements. So if you could follow this pen light with your eyes. And now I will check for a quick vision test. If you could please read out the smallest letters that you see.
A. T. V. C. O.
Good. Okay. And I'm going to check for your hearing as well. Close your one side of your ear for me. Okay, and then repeat back what letter I whispered to you.
8.
Okay, other side.
2.
Okay. And back to the eyes. I need to check for your peripheral vision. Cover your right eye for me with your right hand. And let me know when you see my hands, fingers away from across.
There.
Yep. Okay. Other side.
Yes.
Okay. And then now I'll inspect the nose. Why is that off? Is it still going? Oh, still going. Inspect the nose. Mucous membranes are pink, moist, no septal deviation. I'm just going to check your smell, your senses, okay? Close your eyes for me. And let me know what you smell.
Alcohol.
Okay. Okay. Next I'm going to check your hearing some more. I'm going to place this tuning fork on your head, and I need you to tell me if you hear it better with your right side, left side, or if it's equal to both.
Both.
Equal?
Mm-hmm.
Okay. And I'm also going to check it. I'm going to place this behind your ear. When you stop hearing something, let me know, then I'll put it by your ear to see if you can hear some more, and let me know when you stop hearing it.
Okay. Okay.
Okay, check the other side.
Okay. Okay.
Good. Okay, now I'm going to check your neck. I'm going to check the inside of your mouth here. Mucous membranes are pink and moist. Tongue is midline. Go ahead and say ah for me.
Ah.
Visualize midline as well. Lift your tongue up. Okay, back down. Soft palate is smooth. A little bit rough for the hard palate. Go ahead and smile for me. Show your teeth. Okay, frown. Okay, raise your eyebrows. Wrinkle your forehead. Okay, puff your cheeks. And go ahead and stick your tongue to the side of your cheek. I'm going to press on it. Okay, other side. Okay, let me check your neck. I'm going to look for any nodule. Check the skin of the neck. Everything seems okay. Check the trachea is midline and palpate the thyroid gland. Okay. If you could shrug your shoulders for me. Okay. And I'm going to palpate your lymph nodes, starting with the occipital near the base of the back of your head, the pre-auricular, the post-auricular, the tonsillar, the submandibular, the submental, anterior cervical, and posterior cervical, and the supraclavicular. Okay, let me see your arms. Arm length is equal, symmetrical. Inspecting the joints. No inflammation, no redness, no abnormalities. Side. And now check the range of motion. Put your hands behind your head and behind your back. Okay. Let me see the arm. Go ahead and flex your arm. Straighten it out. And the wrist. Fingers. Okay. And both legs out. Equal in length as well. No inflammation to the joints. Okay. Go ahead and push up with your toes. Okay. Push down with your feet. And straighten your leg out. Good. Good, strong hand grip. Now I'm going to check for the deep tendon reflexes of the knee. Good. Also check the Achilles tendon. Bicep, go ahead and flex for me. Okay. And then the tricep. Okay, go ahead and stand up. And if you could, walk a few steps that way and a few steps back.
Is it still recording?
Press it.
Press what?
Press down on the... Okay, stay still and close your eyes. Okay, good. Good balance, just checking for balance. Go ahead and take a seat again. And if you could take your right heel and rub it up and down your left shin, all the way up and then down. Okay, and then do the other one. Good. And if you could turn to the side for me so I can assess your spine here. Normal curvature, noted. No scoliosis or kyphosis. Okay. Next, go ahead and shrug your shoulders for me. Turn your head to the left and then to the right. Look up and down again. Okay, next I'm going to check for your sensation, okay? I'm going to be poking you or touching something sharp for pain and something soft, so just let me know what you feel. Go ahead and close your eyes.
Sharp. 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 Soft. 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 Sharp. Soft.
Okay. Good. Okay. Now I'm going to check your lungs. Go ahead and turn to the side for me. First, I'd assess the chest and also the skin. Make sure there's no abnormalities. Then I will auscultate the lung sounds. Okay, as I move this, I just need you to take a deep breath in and out, okay?
Okay.
And 2 more locations in the front. Good. Lung sounds are clear. And percuss. And let me percuss as well. Okay. Go ahead and lie down for me. So I'm going to auscultate the heart sounds. First would be the aortic, which would be the right side, second intercostal space, using the diaphragm. and then the pulmonic, which would be the left second intercostal space. Orbs point, left lateral to the sternum. And the mitral, midclavicular fifth intercostal space. I would also be checking for bruits to the carotid. And then I would palpate the pulse. First the carotid, one side at a time. +2 pulse. +2. The brachial. +2. And then bilateral radial pulse. +2 as well. And then I would check the popliteal or femoral. Both sides. And then the popliteal. A little deeper. I'd say +1 for the right side. Both +1. And then the dorsalis pedis. And +2. Okay. Next I would check for cap refill. Color return less than 2 seconds. And I would also check for edema. Upper and lower extremities. Okay, no edema noted. And I would also check for skin turgor. Okay, no tinting. Next, I will examine the abdomen. First, I would assess the skin, look for any signs of hernia, any discoloration, or any masses, or any abrasions, rashes, anything abnormal. And then auscultate bowel sounds to all 4 quadrants. Bowel sounds active to all quadrants, and I would palpate all quadrants, soft and a deep palpation. Then I would check the Murphy's point for any gallbladder abnormalities. Go ahead and take a deep breath for me and hold it in. No pain. And I'll also check McBurney's point. That would be in the right lower quadrant. About a third in, just below mid-clavicular line. could also percuss the bell. So all 4 quadrants. Thank you. And then finally, I would do an assessment on the genitalia and rectum, where you would check for any kind of hernias, check for the lymph nodes. You'd also inspect the genitalia for any kind of lesions, rash, or masses, as well as the periarea and rectum for the same thing, lesions, rash, or masses, or any kind of skin breakdown. For females, breast exam would also be included. And for men, we would do either a testicular and or prostate exam, if applicable. And that would conclude my physical exam. Take off my gloves, wash my hands. Thank you.